Hello and welcome. We have a new health policy. The big question is, how will this health policy translate and into what? And what are the three big challenges if we can make it into that? Joining me to discuss this is Kiran Mazumdar Shaw, founder of Biocon. Kiran, thank you very much for speaking with us. So there is a new health policy, but if we were to build a slightly more medium to long-term outlook, how does this convert into challenges that you see are listable in some ways and then implementable or executable?
So if you look at the wish list that has been expressed in this healthcare policy, I think we have huge challenges. I mean, if you just convert the 2 beds per 1,000 population, we actually are short of 2 million hospital beds, okay? And if you basically then, extrapolate that data to the doctor shortage that we have, the nursing shortage that we had, there's a huge human resource shortage as well, and then added to that is the fact that we have a huge shortage of specialists, okay. So I think if you look at the healthcare, policy overall, I don't think you've addressed these kind of challenges, but you've just said what you want to do. So that's a good starting point. Having said that, I think you need to also understand that if you want to basically create 2 million hospital beds, okay, the private sector will need to create it. But it's a bit of a vicious cycle, because the private sector is not going to invest in creating those 2 million hospital beds if there isn't a reimbursement mechanism that makes it viable, and equally that if you don't have a funding mechanism that makes it viable, it's not going to work. Today, the hospital sector, although the finance ministry has categorized it as infrastructure status, in reality it doesn't enjoy the low interest, long term lending that the infrastructure sector enjoys. So if you don't do that, if you don't implement that, there is going to be no investment in hospitals.
So what shortcoming does that reflect in the way the policy was drafted?
So I think you need, one of the biggest challenges that we have in this country is that there is no alignment of policymakers, regulators and the stakeholders. I think stakeholders are always excluded when there is a policy being made or regulations being formed. And I think there needs to be alignment of all three in mission mode. If you can do that, I can tell you every one of our problems will be solved. So the healthcare policy is a great, long awaited policy, and it's a welcome policy, but it is more of a sort of a statement of objectives and a statement of aspirations. Okay, you're going to spend, the spend is going to increase from 1 to 2.5%, but I think it's very low, because you're kind of trying to do it over 220 by 2030, whereas I personally believe you need, 2025, but I personally believe that you need to, jump it to a much higher level. Secondly, health assurance, health insurance, we also know that you have to be very careful about health insurance schemes. It should be basically restricted to surgeries and not everything else. And there are a lot of aspects about, how to prevent abuse and misuse of health insurance. So I think if you talk to stakeholders, key stakeholders like the hospital, like hospitals, like patients and doctors, you will actually get to know what works and what doesn't work. So I think the devil is in the detail. It's well-meaning, well-intended, but it's a daunting challenge for a country like India.
Right.
And I think we need to use again technology. I think e-healthcare is a big opportunity to bring in transparency and accountability, and we need to focus on that.
Right. So let's assume there, like we've seen active interest in businesses or corporate setting up hospital chains. Assuming, let's say, that part or the creation of the 2 million hospital beds happens because people see opportunity, entrepreneurial opportunity.
And where are the doctors?
Right. So that was my next question. So what should then the policy or let's say the regulatory structure really focus on, rather than maybe what is linked to private capital?
So Govind, let me give you some perspective on the challenge, okay? Today, we basically churn out about 50,000 medical graduates every year, and only 15,000 of these have got the opportunity to specialize in some aspect of medical science, okay? We don't even have the specialization seats aligned with the real unmet specialization challenges that India has. We have a huge burden of cardiovascular disease, oncology, diabetes, but if you look at the number of diabetologists, the number of cardiologists and the number of oncologists, it is shockingly low.
Yeah. And I'm assuming you're still referring to urban, because as you move away from
Yeah,
urban India,
and
it's almost
I mean, it's even worse
non-existent.
when it's
Yeah.
non-existent. So, we have a lot of challenges. Now, you keep talking about sending medical doctors on compulsory rural service, okay? First and foremost, our medical doctors are very, very basically, sort of trained. I think you need a much bigger agenda for our medical human resources. Then you need a huge number of nurses. There is a dearth of 3 million nurses today. So the whole nursing requirement has to be looked into. So I think we have a lot of things to do
Right.
to
So
really effectively deliver on a working healthcare model.
Right. So on the supply side, between physical and non-physical, so would you place more emphasis on the physical goods or the non-physical, which is the doctors, the nurses, at this point?
I think at this point in time, I would spend a lot more time on the human resource element, because building hospitals doesn't take too much time. I mean, you can even rent out existing buildings and convert them into hospitals. But what is really the need of the day is,
Right.
the specialists that we need. We are woefully short of specialists. You need almost like 500,000 more specialists in every one of these sectors that I talked about. And if you look at the numbers who are graduating every year, as I said, combined they are 15,000, and you have a dearth of 300,000, 200,000, 100,000, 500,000 specialists in each one of these. How are you going to bridge that gap? So,
Right.
there's a huge challenge. Again, we need to change our medical education. MCI has been really playing a very negative role in the way medical education is being evolved. They have
By controlling capacity?
by controlling capacity. I think it's been a very unethical and corrupt system. It needs to be broken. Of course, thanks to NEET now, at least some of the medical education at the entry level is being broken. But at the specialist level, we need to make sure that out of those 50,000 MBBS graduates that come out every year, at least 30 to 40,000 should be specializing.
Right. Last question. So, in a more idealistic front, if we were a healthy society, that maybe lesser people would need all this care that obviously needs to be built in any case. What in your mind should we be doing, or how should we be approaching
So I
that?
think that has been captured well in terms of its intentions. You need predictive and preventive medicines. You need a lot of technology for predictive medicine, and I think there the genomic sciences and the whole focus on informatics and bio IT as such is going to be very important for both predictive and personalized medicine. That's where we should actually take a lead in terms of transforming healthcare delivery.
Right. And as a company that is again on the supply side, but with medicines and so on, how do you approach this? I mean, is it Herbalife, and are these the ways to address some of these problems?
Well, I think every part of biosciences has a role to play. So yes, I certainly think nutraceuticals have a role to play. I think we also have a huge opportunity to combine both nutraceuticals and pharmaceuticals, because today the whole area of microbiomics is playing a big role in health management, and they know that combining pharmaceuticals and nutraceuticals to treat certain diseases does augment positive outcomes.
Right, that's a good note to end on. Thank you so much, Kiran
Thank you.
Mazumdar Shaw.